In this video, we're going to discuss how to go about applying for general practice training in Australia. Hi there, I'm Dr. Anthony Llewellyn, the Career Doctor, here to help you manage your medical career right here on YouTube, Facebook, and LinkedIn. This video is going to be specifically for any trainee doctor or international medical graduate who's considering general practice training in Australia. In the video, which is part of our Dr. Job Summit in 2021, Dr. Vanessa Moran, who's a Director of General Practice Training for ACT in New South Wales, is interviewed by my colleague, Dr. Rachel Seaniger. And in the video, Vanessa discusses the two colleges that select trainees. So that's the Royal Australasian College of General Practitioners and the Australian College of Rural and Remote Medicine. They both select trainees into general practice training. That's done by the general practice training provider largely, and there's slightly different frameworks and approaches for both of those types of interviews. But in the main, both interviews will probably be a multiple mini interview. So Vanessa goes over the sort of questions that you might anticipate being asked, how to look at the selection criteria and think about what sort of questions you might need to answer in these interviews, some frameworks for coping with some of the different types of questions. And importantly, and my favorite thing, she talks a little bit about you being able to answer the most fundamental question about applying for general practice training, which is, why do you want to become a GP? And I suggest you do watch all the way through the end, because towards the end, Vanessa also talks about some common pitfalls that candidates might have in the interviews and how you can avoid them. So sit back and relax, and I hope you enjoy the video.
Okay, welcome everyone. Thanks for coming along to yet another talk in the Dr. Job Summit. With us today, we have Dr. Vanessa Moran. I forgot to check that that's how you like to have your name pronounced. Fantastic. She's the current Director of Education and Training for ACT in New South Wales and has been a medical educator for 9 years at GP Synergy. We're very lucky to have her here talking to us today about GP training, interviews, and the process of getting into GP. So welcome and thanks for coming along to talk to us, Vanessa.
That's fantastic. Thanks, Rachel, for that introduction, and welcome everybody online tonight, and if you're watching this recording later as well. So I am having a bit of a chat today about GP training interviews, and I'd like to start again by acknowledging NAIDOC Week. Happy NAIDOC Week, everybody. And I'd like to acknowledge the traditional owners of the land of which we're all meeting on tonight, and pay my respects to elders past, present, and those new leaders that are emerging. I am here on Awabakal land in Newcastle this evening, and I pay my respects to anybody here that identifies as Aboriginal or Torres Strait Islander as well. And I hope our NAIDOC celebrations haven't been too impacted by our current COVID situation. It's always wonderful to get to a NAIDOC event if you can. So a little bit more about me, I guess. I am a GP, certainly what I identify with first and foremost. And I started my GP training back in 2006. And I absolutely love general practice. I love the breadth and depth of what you can do in general practice. I certainly love clinical medicine and everything that comes with that. I started off with a very strong interest in paediatrics and women's health, and I had about a 30 to 40% patient cohort of paediatrics, so I really enjoyed that. And then I started to get interested in expedition and wilderness medicine and spent a bit of time doing that. And then I also loved educating. I loved educating my patients, and I also really enjoy educating registrars to become GPs and their supervisors, and of course the medical education team. So that's what I've loved about general practice, is the avenues that it's enabled me to pursue during my career. As a medical educator, I probably need to update my bio because I've been working for GP Synergy. I just hit my 12-year anniversary actually, and I've been the Director of Training for 5 years. And so what that means for me is probably a lot of paperwork, but what it means for you is that I've got a lot of experience in general practice training, and in particular, many years of participating in the interviews and on the interview panel. So I'm hoping to give you some of my, impart some of my wisdom and knowledge that I've gained over the past few years. So a little bit about GP Synergy and who I work for. GP Synergy delivers Australian general practice training to doctors that want to specialise as GPs in New South Wales and ACT. So we cover the whole state and territory. And unlike our specialist brothers and sisters, our other specialist brothers and sisters, there are 2 colleges that you can join to become a fellow to be a GP. So either the Fellowship of the Royal Australian College of General Practitioners or the Fellowship of the Australian College of Rural and Remote Medicine. And they are both fantastic vocations, and we'll talk a little bit more about both of them and the interviews for both of them. So the Australian General Practice Training Program is the most common way that doctors will specialise as GPs, and it's the most supported pathway. It's a government-funded pathway. And of course, like any specialty, you do need to be selected into that specialty to do your training. And of course, you'd also need to complete your training requirements and your assessments in order to specialise as a GP. So the GP training interviews, what I'm going to cover about those tonight are really, hopefully you'll be able to understand a little bit more about the structure of both RACGP and ACRRRM interviews. I'm going to go through a little bit of a framework for answering interview questions. So you can really use this for any type of job interview that you might pursue, or if you're looking at doing selection criteria or meeting selection criteria when you're applying for jobs. I'm also going to go through some common pitfalls and some of my top tips for acing interviews. So, of course, the first question is why do we bother interviewing in the first place? And really, the interview process is really to see whether you, as that candidate, will meet the selection criteria that we're looking for. And those are very standardised for the colleges. What we're hoping that you'll do in an interview is to demonstrate your qualities, your knowledge, and your skills. And unlike an exam, we want you to show us what you do and not what you know. So really take that into your mindset as you're heading into the interviews. We want you to show us what you can do. Why do we interview, and how does that interview result in a training offer? Well, when you do an interview, you are scored, and that performance score does or may lead to a training offer. So because the Australian General Practice Training Program is government funded, the government or the Department of Health has a cap on the number of positions that are available every year. And we have more people applying for those jobs than we actually have available. So when you apply to either ACRRRM or RACGP for your training place, those colleges will do an initial assessment, and then they provide the training organisation, so us, GP Synergy, with an allocation of candidates for the interviews. And they'll usually give us a percentage more than the places available. We then use your interview score to create a merit list, and we rank that from highest to lowest. And of course, those offers are based on merit, and that's up to the number of positions that are available. If you didn't happen to get a score high enough to be offered a position in the location that you wanted, you are actually offered an opportunity to reapply in a different pathway or a different location if you're eligible to do that. So that's something to keep in mind as well. You might not always get your first choice, but you might find that the second option for you, it turns out to be just as good, if not better. And we've certainly had many registrars that have enjoyed their experience wherever they've landed. I can see a question, Gemma, about how many more interviews are there compared to positions available. That does depend. It's usually at least 10% more, but it might depend on where that is. And last year, due to COVID, we actually had about 150% because we were not able to do some of the earlier exams. So it does depend. So remember earlier I said, we want to see if you're meeting the selection criteria. Well, this is the selection criteria for ACRRM. And so really what we're looking for if you're interviewing for an ACRRM position, that you've got a real demonstrated commitment to working as a GP, and in particular in rural or remote Australia. It is the College of Rural and Remote Medicine. We're really looking for somebody that's interested in, working somewhere like here. We've got a quad bike injury, someone that's interested in developing the skills that they're going to need for working in a rural and remote area like this. So this is our farm day where we're learning lots of skills. One of the selection criteria for ACRRM is a demonstrated connection with a rural community. Now, that doesn't mean you need to have grown up with a rural community, but it might mean that you've made a connection during a medical student placement or during a JMO rotation. And we're really looking for somebody that wants to meet the needs of rural communities through an extended scope of practice. What does that mean? When you are a GP working in a rural area, you'll often have a little bit of an additional skill that might be in emergency, it might be in obstetrics, or it might be in palliative care. And so we're looking for somebody that might be interested in that as well. And of course, we're looking for somebody that's got the characteristics that's going to translate to a successful career in rural or remote practice. And really that means that passion and commitment for rural and remote medicine. Now, for RACGP, they are looking for GPs that are interested in comprehensive general practice anywhere in Australia. And the RACGP are looking for these characteristics and this skill set. Now, of course, it's not expected that you're going to have all of these when you interview, but these are the things that you're looking to achieve as a GP with RACGP. So we want somebody that has an interest in holistic care. And what does that mean? We sometimes call it cradle to grave, or it's where you're interested in everything from dermatology to cardiology to maybe doing a diabetic foot exam, which I think is what's happening here. We're looking for someone that's got the ability to manage uncertainty. In general practice, sometimes a diagnosis isn't revealed to us for some time. It might take days, or it might even take weeks or months. And sometimes that's a real challenge to deal with that uncertainty, and that's something that we work towards during your GP training. We're certainly looking for somebody that's really interested in a range of clinical skills and experience, both diagnostic and therapeutic. And remember, I was saying my journey took me on a different down a couple of different paths, and that's something that we're really looking to explore in general practice. Somebody that's really interested in the breadth, but might also be interested in something a bit specific as well. Like all doctors, I think communication skills are key. And certainly in general practice, communication skills is something that we really are looking for, in particular in an interview. And your communication skills, you can demonstrate in every single one of those multiple mini interviews, regardless of what the question is. So that's something really to practice and make sure that you nail in the interviews. And of course, eventually we're looking for you to have clinical independence. Whilst general practice is definitely a team-based sport, we do still also, expect you to work independently as a GP in your future career. So one of, one of the things I always think about is, regardless of which of the colleges you're interested in, the most important thing is to reflect on why you want to be a GP. I want you to make sure that you can really clearly articulate that in your mind. And I'm going to stop and pause for a moment. And if you've got a pen and paper, I want you to jot down in your mind, why do you want to be a GP? If you're brave, type it into the chat and send it. If you're not brave, type it into the chat and delete it. But I really am going to give you 30 seconds or 60 seconds to stop and think about that. The better you can articulate that, the better you'll be in the interview. I'm wondering if anybody might be brave enough to hit send. Do you think, Rachel? Oh, someone's typing. Good on you, Rohit.
We usually have at least someone who's brave.
Excellent. I love bravery. Sometimes you might not be exactly clear that you want to be a GP. And that's okay too. And I love that working closer to community, Rohit. That's absolutely something that general practice is absolutely striving for. I think work-life balance is probably a bit difficult for all of us as doctors at the moment, let alone general practice as well. I certainly think as a fellow GP, you do get to make some pretty good choices about where you work and how much you work, which is fabulous. So thank you, Rohit, for being brave. That's wonderful. I really want you to take those thoughts forward. If you don't have a clear answer about why you want to be a GP, then do spend some time thinking about that. So the interview structure is very interesting. So it's really good to be prepared for your interview. And they might be unlike anything you've done before. I almost think they're a bit more like doing an OSCE exam as a medical student rather than a job interview. If you can, I highly recommend practicing. And you'll hear me say that a lot tonight. How did you sound? Were you rushed? Were you clear? Did you mumble? All those things are really important. So for RACGP, they're actually the structures are very similar but slightly different. There will be 5 common questions that the RACGP sets for the interviews, plus up to 3 more, depending on the regional training organisation you're interviewing with. There are either multiple mini interviews where you move from one station to the other to answer a different question, or it might be a panel where you have 2 or 3 interviews and they ask all of the questions, interviewers. There's 2 minutes to read each of the questions and to prepare your answer, and then 8 minutes with the interviewer to answer your question, and that's face-to-face or remote. Now with GP Synergy, there are just the 5 common questions, and it is different interviewers, so multiple interviewers, and we do that remotely by Zoom. It's very, very well organised and perfectly timed. Sometimes we're unable to accommodate applicants, and we've occasionally done a panel for a makeup later, but the majority of them are the multiple mini interviews, so it's really, really worth practicing those. With ACRRRM, again, multiple mini interviews, and there are 6 of those, and again, they're conducted at separate stations. You've got 2 minutes. This is very similar, as I said, 2 minutes to read beforehand, and then 8 minutes to speak to the interviewer. And what they're looking for is for you to communicate that proposed course of action that you're going to take, or any ideas that you might have in relation to that question. And of course, it's a new question at each station. That's the same. And similarly for GP Synergy, that is a Zoom set of interviews and in remotely done and with different interviewers at each station. So how do you manage those? Again, do go back to review the selection criteria or the applicant information for your college. I do want you to think about some cases that you could use to meet those criteria. So what examples have you got to maybe meet those criteria? And if you're struggling to think about things, I'd also recommend you have a look at the college curriculums. Those are also going to give you some really good clues as to what we're looking for, things like communication skills and clinical skills. I said I was going to mention this a few times. Practice, 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 practice. Practice your timing. What does 2 minutes feel like? What does 8 minutes feel like? Practice changing topics so you don't get stuck down one path. Practice how you sound online. How do you look online? Do you look like this, or are you sitting back nice and centered in the screen? How do you sound? Can the interviewer hear you clearly? Is it time to invest in a good headset, like I can see Rachel's got there, with the headphones and the microphone? Or is your computer set up well to pick that up? It's amazing. You don't want to waste a minute repeating yourself because your sound quality is poor. That's a minute that you could be really displaying what you know. What's next? So these are some of those really common themes that we might see in interviews. So, the common theme might be demonstrating leadership. So could you describe a time when you needed to take charge of a situation? Ethical scenarios are very common, where you might have a little ethical dilemma that you've got to talk about. Cultural competency, that could be Aboriginal and Torres Strait Islander health competency, or it might be culturally and linguistically diverse competency. So having a think about those two, and what patients have you seen so far in your career where you've been able to demonstrate your cultural competency. Conflict resolution is a very, very common one where you work in teams as GPs, you work in teams in the hospital. Conflict is a fact of life, and conflict resolution is extremely important. So if you can think about those sorts of scenarios, that will be really helpful. There will, of course, be clinical scenarios. Now, they're not going to be really complicated radiology questions that someone like Rachel might be able to answer. They're going to be general practice questions. So they're going to be things like chest pain or asthma or, a laceration, or things that you will have seen perhaps in an emergency department, or you might have managed on a night shift. I've mentioned working in teams already. That's definitely another common theme. Now, maybe managing a challenging patient, and I've got a bit of an example about that later. And of course, as I said before, communication skills. But don't think about communication skills as one separate little box entity. Think about how you can demonstrate your communication skills throughout the entire interview. So this is an example of how a question might be structured for you. Tell us about a time you had an angry patient or family member. How did you manage the situation? And you may also get some prompts underneath that question as well. So the interviewer might ask you a set of standard prompts, but they're not going to ask you anything really probing. They're not allowed to. They can really only ask you what they've been specifically instructed to ask. So they might be simply instructed to prompt something along the lines of, tell us, what you would have done in this situation if X had happened, or something along those lines. So communication skills is always a good one to practice. And what I've got next is to perhaps go through some interview frameworks for you. So as a GP, we like to have our clinical guidelines or our frameworks to work off. And I think pretty much interviews are much the same. So I think about interviews in a couple of different ways. One of them would be about reflecting on a past experience, and they're pretty common. You'll probably get a couple of those. And a really good framework to reflect on a past experience is the STAR framework. And that's where you've got a situation that you're going to describe. You're going to talk about the task that was required of you, the action that you took, the result, and I add in another little R for that, and the reflection. So maybe the reflection that you've had that maybe you would do something differently, or the reflection that you had that your perhaps one of your team members did that you didn't specifically do. So reflecting on a past experience questions would be maybe demonstrating a leadership question or an ethical scenario. Certainly conflict resolution and working in teams would certainly be some of those. So those, you can start thinking about some of those examples now. So just to work through this framework, I've got my first, go back to that example that I had that was, tell us about a time that you had an angry patient or family member and how did you manage the situation? So you want to bang that situation out right up front. So, I tried to remember back to when I was a resident medical officer, and, I think this is probably a fairly common scenario. We had a really old patient. They'd had an intracranial bleed. Their prognosis was really poor. And we really felt as the treating team that we needed to withdraw care because there really wasn't going to be meaningful quality of life. So that was the situation. What was the task? Well, we had to tell the family that we wanted to withdraw care from the patient. That's pretty simple. The task might be something simple as that, or it might be something a little bit more complicated. What was the action? So actually, me as the resident, I didn't have much of an action because I knew that the consultant was going to be the one that was doing the heavy lifting here. But I did know that it needed to be managed well. So I made sure that the family knew that we were having a family meeting. I made sure that there was going to be a time available where they had support, that the consultant was going to be around. I made sure that there was a meeting room available and that there was plenty of time to discuss this. So we made sure that the team in ICU knew not to disturb us unless it was, an absolute crashing patient. And the action, of course, although the team had put in lots of preparations, they were still very, very angry. And the further action was that my consultant was really, really patient. They listened really carefully. They did lots of active listening and they addressed their concerns really specifically. So pretty complicated actions there. And then what was the result? So what I noticed the result was that by taking that time and really listening carefully and addressing each one of those concerns really specifically, we got to a resolution. So we didn't quite get to where we wanted to be, but we certainly had made some plans with the family members and they were no longer angry. And we were happy with, the care team was happy with those plans as well. And here's where I add in my other R for reflection. And that's where I'm saying, although I didn't have to do this personally, I really learned a lot from that experience. I learned how to manage that. And I also learned in our team meeting afterwards what the consultant didn't like about what they did and what they would have done differently as well. So I found that a really rewarding experience. So you can see how perhaps you might not have an example that you've got, but you've certainly got something that you've observed that you can also use in your interview as well. So do have a think about those as well before your interview so that you've got those fresh in your mind. Because, when we're all really busy at work, we can sometimes really forget those specific examples. So now it's your turn, again, just to have a little think about a question that is in that same sort of vein. So describe a time when you disagreed with advice from another doctor that you were working with and how you went about resolving that issue. So again, if you wanted to type something in the chat that you might have, please feel free. But I want you to, again, think about that in that STAR framework. What was the situation where you disagreed with somebody? Was it your boss? Was it your registrar? Was it a nursing staff? Was it somebody else in the treating team? Actually, although that says doctor, but you might not have a doctor. So you could definitely go into the interviewer and say, I actually don't have an example with a doctor, but I can think of one where it was with the physio. And, we came to a really good outcome. So I'm going to explain that one. Think about the task. What exactly did you do? The task was that I, decided to have a difficult conversation with them, and I took them aside and explained why I disagreed with them, and was really curious with them about what their opinion was and why they had come to their conclusions. Talk about the actions that you yourself specifically took. Again, try and be specific about your actions if you can. And then, of course, do talk about what the result was, good or bad, and add in your reflections as well. So think about your star. Excellent. So I'm looking at the clock here. Oh, excellent. I think we're doing quite well. So if you're talking about future plans and your question asks about what sort of future plans, my framework for that is what, how, when, and why. So WHWW. You can probably add in all the other who, what, when, how, why, and the rest of it into there. But what actions do you plan to take if you're talking about your future plans? How do you plan to undertake those actions? When do you plan to undertake those actions? And why do you choose to undertake those actions? And I've got another example here for that. So let's say the question asks, what are your rural generalist plans? Or what are your general practice plans? Or what are your rural plans? You could throw anything into there. So your answer might be, so for example, for me, I want to be a GP that has an interest in pediatrics. So what actions do I plan to take? Well, I plan to do some extra upskilling in pediatrics. How do I plan to do that? Well, I'm going to apply for some SRMO positions at the children's hospitals in Sydney. And I might think about doing the Sydney Child Health Program again. That's how I plan to do that. When am I going to do that? Well, I'm going to apply for the SRMO positions for next year. But if I don't get that job, then I'll definitely do the Child Health Program next year. And I'll try and get some paediatric rotations, maybe through my other hospital, even some rural peds terms. And why do I choose those? It's because I'm really interested in the breadth of general practice, but my mentor that does about 60% general and 40% kids, he was great. He was really great for me and my kids, and I'd really like to do something similar. And he told me about what he did to do that. So that's why I'm interested in doing that as well. So again, you can shape that to be whatever is relevant for you to answer those types of questions. And so do have a think about those too. So still, just lastly on that structure of the interview, do use your 2 minutes wisely. And I think the most important thing is to really understand what the question is asking. Sometimes they can be quite long and a bit confusing, and especially if English is your second, third, fourth or fifth language, you may find that you get a bit confused with the breadth of the question. So chunk it down, take it sentence by sentence, and really understand what the question is asking. Brainstorm some situations using the STAR or the WHWW, depending on what the question might be. And think about your opening sentence and how that might highlight the situation or the plan. A bit like writing an essay. You want your little introductory blurb. Use that 2 minutes to refine your answer. Maybe make sure that you've got the right example for that question, because sometimes that you might think, oh, that actually isn't the right example, or I've just come across something that might actually answer that a little bit better. And of course, you're showing what you do. So you want to provide evidence wherever possible. So, and that is difficult in an interview, but your evidence is the description of what you did. That's your evidence that you're showing here.
We've got a good question there about the 2 minutes, whether we can take some quick notes during those 2 minutes to base our answers off.
Yes, absolutely. You can definitely take some notes during those 2 minutes to base your answers off. So that question will be up there for you to have a look at, and you can certainly scribble some things down and maybe even underline some things that you want to make sure that you highlight, so that when you're getting close to the end of time, you might quickly say, oh, I just want to make sure that I add in blah, 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 blah. So great question.
That could be part of their practice as well, is that 2-minute period potentially.
Absolutely. And I think, you can get a bit blindsided by that. And I've got a tip about, having some deep breaths and thinking about it. But it is really good to use that 2 minutes wisely. And it's kind of long but short but long. So I thought I might draw on some of my experience of some of the common pitfalls that I've noticed for our interview candidates. And, they're not rocket science, but sometimes we do forget just the basics. So my first one is just general practice, not really knowing or understanding what general practice is. So remembering this is really like a job interview, and you really need to understand what you're applying for. You wouldn't go for a job interview with the banking industry without understanding a lot about the bank that you're applying for. So do your research. Make sure you've got a good grasp of general practice and a good grasp of the college specifically that you're applying for, because they're expecting that. My next pitfall is missing the question. And that's kind of like missing the gist of the question, really. So either reading it incorrectly, reading it too quickly and not comprehending it, maybe misinterpreting the question. And so taking that 2 minutes to really comprehend the question for me is so important. And if you haven't got time to jot down your answers because you're so busy comprehending the question, well, that's really valuable time well spent. My other common pitfall that I actually do see fairly often are rehearsed questions. So I do know that there are banks out there of previous questions that have been remembered by candidates, and sometimes they can actually do you a disservice. So while they may be helpful for you to do some practice, pre-rehearsing a script I have definitely seen backfire, where somebody said, oh, I know what that question's about, and they've dived into their pre-rehearsed script, and actually that hasn't answered the question at all. So be really careful about that as well. Make sure that it's really good to prepare your scenarios, but they do need to match the question that you're asking. A pitfall might be to not have examples. Now, it's really okay to not have experienced that situation personally. You might be a baby like this one here. You might be an intern and you just haven't had that experience, but you'd still make a fantastic GP, and we want you on our training program. So if you can, the worst thing you can do is to not think of an example at all. If you can think of an example that you've observed, that's fantastic and just as good as if you've done it yourself. So do bring that up. So do try and rack your brains as much as you can for something you've observed if you can't think of something that you've experienced personally. All right. And next I'm going to finish on my top tips that'll take you wonderfully into your interviews. So of course, do research your college curriculum. They're really easy to find. If you just Google ACRRRM curriculum or Google RACGP curriculum, they'll be there at your fingertips. Have a look at those. ACRRRM has 8 domains of general practice and RACGP has 5. So do have a look at those. What are they about? What questions might people ask me around those curriculum topics? There's lots and lots and lots of clues in the curriculum for how you can do well in the interview. Take your time. I know that I said sometimes 2 minutes and 8 minutes can seem very short, but it is actually quite a lot of time. And I very rarely see candidates run out of time. It's more common to see candidates finishing their question early. And the interviewer is there to help move you through that 8 minutes and make sure that you cover all the parts of the question as well. So do have a really big, deep breath, center yourself, to give yourself that time to focus. Make sure that you've understood, read that question, maybe highlight some of those keywords, but do take your time when you're answering as well. It's a bit like, doing a presentation. You don't want to be rushed. You want to be able to speak nice and clearly so the interviewer catches everything. If you haven't got one already, I definitely recommend getting a GP mentor. Now, it might be too late if you've got interviews coming up this weekend to find yourself a GP mentor. But if you do have one, make sure you have a chat with them. They will really help you understand what community general practice is about and help you prepare for a career in general practice. And if perhaps you do make it through this interview process and you are unsuccessful, then there's plenty of time to get a GP mentor before second round or before next year's intake as well, to really understand what we're looking for. So you might find that in your own GP, or you might find that through some of connections through the JMO hospitals. We've got GPs that do lots of visits at hospitals for education around New South Wales and ACT. Now, I said take your time, but don't chit-chat and waste your time. So don't waste time with niceties. So you jump in, you introduce yourself, and you throw yourself straight into answering the question. The interviewer has been directed not to ask you about how the weather is, or how your day is, or how COVID's going. And you should really do the same. You want to just jump in there and answer your question. Make sure that you use that 8 minutes wisely. Nobody will think you're being rude. We know that you're in there for a job to do in a short period of time. So don't be offended if we don't answer your question about the weather. And do just dive straight in. So it's actually it's a little bit different with the remote interviews. I found you sort of do find that the introductions roll a bit faster than when you're walking into a room and shaking hands and sitting down in chairs. No more of that anymore. So that the introductions seem to run a bit faster on Zoom. Here it is again, record yourself. Practice makes perfect. As an educator, I actually record myself with my presentations, see how long they take for me to go through them, see how I sound, try and reduce my ums as much as possible. I'm still working on that one. Practice does make perfect. And again, I mentioned earlier, do check your IT setup. How far back are you sitting? Are you nicely centered in the screen? Have you got distracting mirrors and pictures in the background? How can you blank out your screen so that you're really the focus here? And if you can, I do recommend practicing on the platform beforehand. So for GP Synergy, we do use Zoom. You can download free Zoom, the application, and again, practice and record yourself and play yourself back. It's scary, but great at the same time. Mindfulness is one of those things that's just growing and growing in its evidence and utility. And I think job interviews are one of the great places where you can put in some mindfulness breathing techniques. The more you do that outside of the interviews, the better you'll be in the interview, because it'll be much easier to have a quick centering breath. There's lots of ways to do that, and I do recommend that between your stations. So whether you're doing something like an equal breathing in and equal out, so count of 8 in and count of 8 out, or whether you're doing some box breathing, so maybe you might count in for 6, hold for 6, breathe out for 6, hold for 6, breathe in, box breathing or equal in, equal out. Or maybe just a really big centering breath where you breathe all the way into the bottom of your abdomen and all the way down to your tailbone. Massive breath in, a huge sigh out. and really create some space and release some tension. Really significant evidence to say that that can reduce your heart rate. A simple centering breath. So have a think about practicing those as well. Self-reflection is something that's extremely important in general practice and in general practice training. It is how we learn, it is how we explore, and how we better ourselves for our lifelong learning journey as GPs or as doctors in general. So if you can demonstrate some self-reflection, that also goes a really long way. Nobody's expecting you to be perfect in these exams, or in the exams. Maybe we're expecting a bit more perfection in exams. We're certainly not expecting perfection in your interviews, and we do encourage self-reflection. So if you've got an example that maybe didn't quite go so well, you might demonstrate that as well and provide what you've reflected and what you might do differently next time. That's also really useful too. My final tip is to keep to routines. So just like an exam, don't wear a new pair of pants, don't try a new breakfast cereal, don't do anything that's out of the ordinary, take a new bus route. You want to stick to your routines on the day so that you're not creating more cognitive load or more anxiety for yourself. You do want to make sure you've got adequate food and water so you're not distracted by your thirst or hunger during the interviews. Maybe make sure you've got a nice big glass of water nearby. And of course, do stress in something smart, even if it's just from the waist up. It is an interview, even if it is remote. So we do expect you maybe not to wear a tuxedo and tie, but we certainly expect you to look smart. Portray your best self. So if you've got any more questions or you'd like some more information, there's lots of information, as I said, on both the college websites. We've got stacks of information on our GP Synergy website as well. And you can email us at applicant@gpsynergy.com.au if you're looking for some very specific advice yourself. So I'll leave those up there for a second. But does anybody, and I might even type that into the chat, at gpsynergy.com.au, make sure I can spell correctly. And I'm going to finish off with there if there were any other questions. My question mark didn't come up on that slide.
That is unusual.
Oh, good.
Yeah. We've got someone typing now. Exciting.
Have people got interviews coming up? They are starting in the next couple of weeks. You'd like to know more about my expedition medicine work. Well, there is actually an expedition and wilderness medicine group that used to run lots and lots of expedition and wilderness medicine courses, including one that I did out in the Blue Mountains, which was really fantastic. I did a lot of travel medicine. So a lot of my expedition medicine was counselling people ongoing on expeditions, not so much doing them myself. I did go to Antarctica to do a course as well, which was awesome. And then I ended up getting my director of training job. So my expedition and wilderness medicine career got cut off, and I think there's not a lot to do at the moment, unfortunately, either with COVID, but in a couple of years, hopefully that will be back on track. There's certainly some quite a bit of expedition and wilderness stuff that you can do. Things like, I think in Australia, what you often end up doing is being the doctor for things like the UTA, the ultra training marathons, the 100 in the Blue Mountains, certainly lots of stuff in those areas as well. That was a very specific question, but there you go.
Shows they're listening.
Terrific. Well, good luck, everybody, in your interviews. I hope that you get to demonstrate yourselves in your best light. I'm sure you will. And I really hope to see you on the other side in GP Training Land in 2022. That will be really exciting.
Thank you so much, Vanessa Moran, for coming and talking today for us and reminding everyone to practice. Hopefully that has sunk in. If we don't have any other questions yet, I will just take a moment to say thank you again, and also let everyone here know that we've got 2 more talks coming up this Thursday. One that you may be specifically interested in that flows on well from this is behavioural questions. So that can you tell me a time? So that will be gone into more depth on Thursday as well. That one's at 7 p.m. And Anthony's doing another talk on the standard pathway, which is probably less related to this one. More specific to international medical graduates, but those are the talks coming up this Thursday. If any of you think of any other questions after this and you happen to also have access to the replays, feel free to post that question there, and anyone who's watching this live at a later date, please do post your questions and we'll get back to them as soon as we can. Okay, well, I might stop the recording there.